Nowadays, diabetes has become a significant health concern in Malaysia. According to the National Health and Morbidity Surveys (NHMS 2023), 15.6% of adults, or approximately 1 in 6, are living with diabetes. Concerningly, 84% of young adults aged 18 to 29 years old are unaware of their condition. This lack of awareness contributes to Malaysia having one of the highest diabetes rates globally. Complications from diabetes include eye damage, kidney dysfunction, heart disease, and stroke. Preventive measures such as regular health screenings, maintaining a balanced diet, and engaging in physical activity are essential to combat this growing epidemic. A very good day to all who are watching this video. My name is Grace Eliska Jinar and I am from Diploma in Pharmacy Semester 2. Today, I want to talk about a silent health crisis that is affecting millions of Malaysians, which is diabetes. Let me start with a question. How many of you personally know someone who has diabetes? It is a serious case that it causes serious problems to younger people at an alarming rate. The reality is, diabetes is no longer just an illness for the elderly. For the fact, Malaysia has one of the highest diabetes rates in the country. But why is this happening? And more importantly, what can we do to change it? Therefore, today, I will cover the current state of diabetes in Malaysia, factors contributing to the rise of diabetes, the initiatives taken by the government, and how we can further to improve these initiatives. Last but not least, what we can do as individuals and as a community to ensure that diabetes reduces among the Malaysian people. Let's begin with some shocking statistics. According to National Health and Morbidity Survey (NHMS 2019), about 18.3% of Malaysian adults, that's 3.9 million people, were living with diabetes. More recent data from NHMS 2023 indicates that 15.6% of adults have diabetes. However, the most alarming part is that 84% of young adults aged 18 to 29 years old are unaware that they have diabetes. So let's break it down further. Negeri Sembilan has the highest diabetes rate, which is 33.2%, follows by Perlis to 32.6%, then Pahang, which records diabetes case with the percentage of 25.7%. Other than that, the trend over the years has been concerning regarding this diabetes case in our country. For example, from 2011, 11.2% of diabetes case increases into 13.4% in 2015. Consequently, in 2019, 18.3% is recorded in that year. As we can see, this is an alarming increase. And if we do not take serious action now, imagine what the numbers will be in 2025 or 2030. Another major issue is undiagnosed diabetes. As we all know, in 2019, nearly half of Malaysians with diabetes were unaware of their condition. So why does this matter? This matters much because undiagnosed diabetes leads to serious health complications. For example, blindness, kidney failure, heart disease, and stroke. And most dangerously, nerve damage that can lead to amputations. And that is not just a statistic. This is the things that happen in our real lives. Now, let's look at why diabetes is rising so fast in Malaysia. There are three main reasons. First one is poor dietary habits. People tend to practice fast food culture. For example, more people prefer to eat fried and processed foods instead of having their home cooked meals at their own home. For instance, people prefer to go to McDonald's or Burger King to have their dinner instead of cooking their own food at their house. Secondly, is high sugar intake, which is a bad habit among Malaysian people. As we all know, Malaysia is known for its love of sweet drinks. For example, teh tarik, bubble tea, soft drinks, desserts, and so much more. These desserts and delicacies tend to attract people to eat sweet food at their leisure time to eat sweets at their leisure time, which can causes them to have high blood sugar level. Next is rice-based diet. As a Malaysian ourselves, we eat a lot of rice every day during the morning, afternoon, evening, and even in the night. And these excess carbohydrates can contribute to high blood sugar, and even worse, leads to having diabetes. Secondly, the factors that can cause diabetes is sedentary lifestyle. Nowadays, many people like to spend hours sitting. For example, at school, at work, or even on their own phones. This lack of exercise and lack of movement is sedentary lifestyle. This lack of exercise will cause people to prefer sitting for a long time and causes their body being inactive for a long time too. They also not prefer to go walking or cycling, whereas these exercises are really encouraged among people so that they can help their body in keeping active every day. Other than that, many people also prioritize convenience over health. For example, people prefer to go to the nearby store by their car instead of walking there, even if it's just a short distance. Thirdly, the most common factor that causes diabetes to be common in our country is obesity. Malaysia has one of the highest obesity rates in Southeast Asia. And more concerningly, childhood obesity is rising nowadays, meaning more young people are at risk. This also alarms young parents to ensure that their kids have a healthy diet every day to prevent serious complications during the kids' teenage years and adults. Lack of awareness amongst people also occur about the factors that can cause diabetes. For example, many do not realize that being overweight can increase the risk of diabetes. For example, they prefer to take junk food instead of eating a balanced diet such as vegetables, sufficient protein, and enough balance of fats in their daily diet. The good news is the government is taking action into reducing the diabetes case in our country. So let's look at what has been done so far. Firstly, government has initiated to build community clinics, or formerly known as One Malaysia clinics, in the community. These clinics provide affordable health care for all the people, including diabetes screening. In this way, people can go to the clinic to have diabetes screening, and early detection can help people to adjust their lifestyle to ensure the balance of their blood sugar level in their body. Other than that, they can change their lifestyle from bad habit to a healthy habit, which can help them from prevent the diabetes from getting worse. They can adjust their lifestyle, practicing a healthy diet every day before it's too late. Secondly, the government also initiates diabetes lifestyle program. This program focuses on diabetes patients and helps them to adopt a healthier lifestyle. For instance, patients receive guidance on diet, exercise, and medication to manage their condition better. These steps also help the patient to maintain their blood sugar level at an optimum level. Thirdly is the sugar tax on sweet beverages. The government has implemented to reduce excessive sugar consumption. However, this movement is not enough, as there are still many people who buy sugary drinks despite of the tax. These initiatives are important, but they need further improvement to ensure that people follow these initiatives so that the government can effectively reduce the diabetes case in our country. So moving on, how can we improve these efforts? First of all, we can strengthening the public awareness about diabetes. Governments can hold more campaigns in schools, universities, and workplaces. For example, they can provide free diabetes screening to school students and universities, lecturers, students, and also the staffs at workplaces. In this way, people can early detect if they have diabetes symptoms, and they can change their lifestyle to a healthier habit so that they can prevent the diabetes from getting worse. So, in conclusion, the government must encourage regular blood sugar screenings for early detection among Malaysians. Secondly, the government must encourage healthier lifestyles in Malaysia. For example, government can invest in public parkings, cycling lanes, and affordable fitness centers. In this way, people will be more active in walking around the park instead of just go to their destination with cars. Other than that, the government can also organize community exercise programs like aerobics or Zumba. We see that many people are interested in these activities like Zumba or aerobics, as they can implement this into their daily hobby. And with this hobby, they can ensure that their body keeps on active every day. And this can help them from controlling their blood sugar level from peaking too high. So, these are the steps that can be done to ensure that initiatives that is held by the government to work efficiently. Other than the steps that the government can do to improve the initiatives, government can also provide better food choices in restaurants or public food catering services. For instance, restaurants and food manufacturers should offer healthier options. They should offer healthy diet that based on the Malaysian healthy balanced diet. For instance, the food that is offered should obey the healthy diet balance that is organized by the Ministry of Health Malaysia. For example, more diet of food should be focused on vegetables and fibers, and also fruits, whereas the sugars, fats, and carbohydrates should be reduced at a low rate. Secondly, more accessible screening should be provided in each of the area. For example, free or low-cost diabetes clinics can be held in schools, universities, and also workplaces. Government can also provide financial help to provide mobile health clinics in rural areas. This is because less people are getting health services in rural areas as there are less accessibility to health services, which is diabetes screening. Last but not least is community involvement. Families must encourage home-cooked meals over fast food. Therefore, families should reduce the rate of them going out to eat fast food, and instead they should prepare their own meal and cook their own meal at their home. With this way, we can control the amount of sugar, salt, and oils that we use in our home. So, if we take this action, we can definitely reduce the diabetes cases in Malaysia and at the same time support the government's initiatives in reducing the diabetes case in our country. Now, let's discuss a few steps that we can do to prevent diabetes. Firstly, we should choose water instead of sugary drinks. With this way, we can cut our sugar intakes in our body and provides more hydration that is needed by our body. Next, we should also eat more vegetables and whole grains as these are the essential nutrients that is needed by our body. It also provides essential energy to keep our body active for the whole day. Other than that, we should also practice exercise for at least 30 minutes a day. A simple walk is enough. This can ensure our heart to pump efficiently to pump blood to our whole body. We should also reduce fast food and processed foods as this contains high amount of sugar and salt that can cause the imbalance of blood sugar levels in our body. Other than that, we should also get our blood sugar tested regularly. With this way, we can maintain and keep in watch of our blood sugar level to ensure that it is at optimum level and prevent us from having any diabetes symptom that could lead to serious disease. In conclusion, ladies and gentlemen, diabetes is not just a disease. It is a lifestyle problem. But together as a community, we as Malaysian people can reverse this trend by supporting the government's initiative, doing our own part as a part of the community and individual. We should take care of our health and work toward a healthier Malaysia. We should also prove to other countries that we as Malaysians can fight and prove that diabetes can be overcome in our country. Therefore, addressing this issue requires public education in all the Malaysian people, early detection that can be held by the government sector, and lifestyle changes which must be done for each of the Malaysian people. So the time to act is now. Therefore, we should take part each of our role to fight this diabetes disease in our country. That is all from me. Hope there are benefits that can be gained from this video. Thank you and have a nice day.